I want to talk about a new space that I want to create, particularly for people who are going through cancer. I do a lot of videos which are holistic, ranging from cancer to diabetes to heart disease to lifestyle to weight loss to just emotional and mental health. But I think the need of the hour is when it comes to cancer, because we have thousands of messages coming in every week from patients all over the world talking about cancer, talking about immunity, talking about chemo, radiation, what's the best. And this is a disease where you reach last stage and it's filled with desperation of people willing to do anything and everything to extend their life or their lives of loved ones. Now, we live in a world where there are extreme diets, there are extreme conventional medications, there are extreme spiritual paths that people take, extreme exercise parts and fad programs, and then there's supplementation and vitamins and minerals and Ayurveda, homeopathy, all of these things together. The reason and my vision for the space that I want to create is a space where we do it maybe once or twice a week, where people with the disease or families of people with the disease or people who just want to learn how to prevent this from happening to them. Prevent? Yes, absolutely. We can prevent, and then there's destiny. But when we put in our efforts to prevent, everything is possible. So the reason for the space is to use the experience that we have of hundreds and hundreds of patients over the last couple of months and years. What we want to share is we're not on anything big. We have no magic. I'm not God. We're very clear about that. We don't have a magic pill. We don't have a magic formulation. We don't have a herb that grows in Africa or in South America. We have none of that. What we have is lifestyle. What we have on the other side is conventional medication. What you have is an intelligent and brilliant system more powerful than anything on this planet. That is called your immunity. What we all have is nature to support us. We either choose it or we don't choose it. The whole point of this corner is not to condemn chemotherapy or radiation or surgery or doctors or anything like that. At the same time, it is not to talk about vitamins and minerals that will magically change your life. It is not about a particular chant that if you do it 100 times in a day, your cancer is going to go. If it does, great. The point is, there are so many people out there today who are confused about what to do, what not to do. I don't have that answer. I don't have opinions. I have options. Options that you take if it works for you. You take if you feel that there is a gap in your treatment that you have not yet filled. We completely understand that during chemo and radiation, you cannot take antioxidants. You cannot take certain vitamins or homeopathy or Ayurveda, which will conflict with the chemotherapy and radiation, decrease the efficacy of the treatment, and even harm the patient more. We are also aware that there are so many pills out there in the world that can cause toxic reactions in the liver, in the human body, and make the patient worse. We're aware of all these things. We're not here to talk about that. We're here to talk about the gap that has existed in the world for the longest time, which is lifestyle. We understand today that very, very few cancers are caused due to genetic issues. We understand that very few cancers are also caused because of environmental pollution. It's easy to talk about environmental pollution. It's easy to talk about contamination in food, but look at it this way. We're all breathing the same air and most of us are eating the same food. If that was the cause of cancer, then every one of us who are breathing the same air and eating the same food should have cancer. But there's a differentiator in that. There's a differentiator called immunity. Some people have low immunity. Some people have high immunity. Some people have emotional stress that lowers their immunity. Some people are fat. Some people have, they have this kind of body which people would say is unhealthy, but they have happy minds and their immunity is strong. We're here to talk about the fact that cancer is a multifactorial disease. What we mean by a multifactorial disease is that it takes many, many, many things to occur in your body before that mutation happens. And it just doesn't happen the day that you were diagnosed with cancer. It's been happening in your body 6 months ago, 1 year ago, maybe even 2 to 5 years ago, slowly building up. And as your immunity gets weaker and weaker, we allow these mutations to escape the natural intelligent defense mechanism of the human body, which is called immunity. So when cancer, just not cancer, cardiovascular, diabetes, these are all multifactorial diseases. You don't get diabetes because you ate too much of sugar. You get diabetes because you probably ate a lot of sugar, you had a sedentary lifestyle, you had less sleep, you were overdoing it on the alcohol. Many, many, many factors put together that causes diseases, and cancer is one of them. So you have to have an approach which is also multifactorial. When the disease is multifactorial, you can't have a one-pronged approach which is just chemo or just radiation or just nutrition for that matter. Like I told you clearly, we're not here to talk about doctors and chemo and radiation. We're here to talk about what if, imagine, what if you were on a conventional treatment, and what if you were also working on getting the right nutrition into your body to support your immunity, the right amount of movement to support your circulation, which supports your immunity and supports your healing. What if we were talking about the right amount of sleep? Because everyone knows that the magic of healing, rejuvenation, cell repair, all of that happens while you sleep. Detoxification happens while you sleep. And then the biggest point, where today psychologists and psychiatrists around the world and even top doctors are talking about the relation of emotional chronic stress with disease. So what if, imagine, you have your conventional treatment running. That's your choice. This is not a replacement for your conventional treatment. This is not for you to go and fight with your doctors. This is for you to make an informed decision for yourself. What if you moved your conventional treatment with everything that we've not been doing, which is moving closer back to nature? It doesn't mean you're only eating organic food. It could just mean that you're eating the right food and feeding food to a body that is capable of absorbing what you eat and utilizing what you eat the right way. It's about integrative approach towards your healing, because there are just too many people who do the whole circle of going conventional all around the world, meeting everyone in the conventional field, and when they're sent home to die, yes, when there's nothing else that medicine can offer you, then that's when you start waking up looking for nature, looking for magic oils, looking for magic formulations. Now, what if you started that search, not for the magic oils because none exist? What if you started that search of the right lifestyle from the time you got diagnosed? Irrespective of your choice of chemo, radiation, or whatever it is. If you do chemo, it doesn't have to be a death sentence. You can use lifestyle to manage the side effects of chemo and boost your immunity. If you do radiation, yes, there are side effects, but if you make lifestyle changes, you can balance the side effects and boost your immunity together. It's a strong, integrated process. You're doing surgery in belief that you've cut off the organ that has the cancer cells. Who's stopping it from coming up in some other part in the human body? And we see that happening all the time. All the time. You surgically remove one breast, it comes up in the second, or in the lungs, or in the brain, or in the pancreas, somewhere else, because we never got to the root cause. So what if you are on a conventional method, but you are also trying to get to what the root cause of your disease was and making lifestyle changes to combat the effects of everything? We've not given this a chance yet in the world to prove. I'm 100% sure there's no research company that's going to be even interested in researching this, because there's no money to be made. But what I can tell you is it's about time that human beings started using their common sense. Yes, there's artificial intelligence and all of that crap that the world's filling up with. It's made a lot of things in life better, but it can never replace the intelligence of the human mind when it comes to sickness, emotions, and healing. You require the human touch, be it your doctor, be it your healer, be it your priest, be it your wife, your kid, your family. Healing can come from any source. Any source. So imagine if you integrate all of this, start from the time you're diagnosed, or forget about that. Why even wait to get diagnosed if you invested in preventing the onset of any disease in the human body? So in this space, the vision and the dream is, we talk about certain things. We talk about reasons why we don't want people to overeat when they're going through treatments. We're not here to challenge doctors, even though doctors tell their patients, eat what you want, have ice creams, have sugar, put on weight. We're here with an understanding that even if you eat all the ice creams in the world and all the sugar, you're not putting on weight, you're putting ugly fat. You're putting on ugly fat. That fat's not going to help you or your immunity or your cancer. There's a way to put on the right weight that your doctors are asking you to put on. But do it the right way, not the wrong way. So we're not here to challenge people. We're here to tell you how to do it the right way. So when your doctor tells you put on weight, number one, understand, why am I losing weight in the first place? What kind of foods can I start eating that may not put on physical body weight, but will supply my cells with nutrient-dense nutrition that can boost my immunity, keep my energy levels high, and let me overcome the side effects of the treatment. It's about that. It's about the right kind of movement, the right kind of sleep, and constantly emotionally detoxifying. What I want to share with you is hundreds and hundreds of cases when we diagnose the root cause of possibly why they got the cancer. And this is not our diagnosis. When we diagnose, we even have the patients agreeing that, yes, Luke, I think it was that. I think it was that. Because when you communicate, you explore. The further you explore, the further you come to what a possible cause could be. Maybe both of us are wrong, but at least we have a path now to work on. So if your cancer, part of your cancer was caused by constant emotional stress over the years, just taking chemo and radiation is not going to help. But taking chemo and radiation and also trying to work with your emotional self and detoxifying your emotions and trying to reduce your stress is going to have a higher, is going to have a more powerful platform of healing for that patient. So it's very important that every human being is different, every single human being, which is why if you have 100 breast cancer ER positive patients taking one chemo drug, all of them will react differently. All of them will not respond the way the doctor wants them to respond to that same drug. Why? The drug is the same, the kind of cancer is the same, but what is different are their bodies, their minds, their previous lifestyles, their history, what is happening inside of them, their cellular strength, their immunity. And if we took all of these things into consideration together, imagine there is 100% possibility that we can have a positive impact on that person, on that person's cancer, on that person's healing. We're just stuck in this world with false beliefs and beliefs that this one pill or this one drug is going to heal us. And I'm happy if it does. But we can't go against nature at the end of the day. We know that. We see what's happening in the environment. Man has gone against nature, and you can look, nature's come back with a vengeance in terms of storms and global warming and everything, and we're products of nature. The further we move away from our core of nature, the more problems we have. The closer we move back to nature, everyone starts getting better in the way they feel, their thoughts, their disease, their appetites, their cravings. So this space is going to start off really soon. We're going to try to do it at least twice or thrice a week. So I talk about a particular subject. You can put in your questions. Please don't ask me for opinions about if this drug is good or that drug's good. I'm not here. I'm not qualified to give you that opinion on what's better. I'm qualified to give you options and tell you from experience with logic and science why you should do what you should do, why you shouldn't do what you're told to do, but how you can integrate things together. Lifestyle, the power of the human body. You may believe in your conventional treatment. Some people believe in nutrition. Some people believe in prayer. Some people believe in miracles. Some people believe just in nature. Some people believe in doing nothing. What if you took all of that and put it together? Imagine. That's what we're going to start doing. That's what the vision of our cancer space is. I'll get back to you when we have our first Cancer Corner. So try to spread this as far as you can, as much as you can to people who have cancer. They can come, listen, take away what they need. If it works for them, great. If it doesn't work for them, they may have learned something. They may have not learned anything, but it is worth a try to use lifestyle, the missing drug in humanity. It's always been there. It's been used. We got to go back to using these little things. And the best part of it, it's inexpensive to make lifestyle changes. It's practically free. It's practically free. That's what we got to start doing. Enjoy your Sunday. Have a great evening. Have a great week next week. Until next time, eat smart, move more, sleep right, and breathe deep.